NKTVত আজি আমাৰ অতিথি হৈছে বিশ্বৰ এগৰাকী প্ৰখ্যাত সাৰ্জন বিশ্বৰ ঐতিহ্যমণ্ডিত ছিংগাপুৰ জেনেৰেল হস্পিটেলৰ প্ৰফেসৰ সিনিয়ৰ হেপাটোবাইলাৰী সাৰ্জন প্ৰফেসৰ লণ্ডন মোৰ হৈতে আছে আৰু তেওঁৰ এই দীঘলীয়া জীৱন পৰিক্ৰমা চিকিৎসা খণ্ডৰ সৈতে তেওঁ জড়িত হৈ আছে আৰু এই বিষয়ে তেখেতৰ পৰা কিছু অভিজ্ঞতা আমি লাভ কৰিব চেষ্টা কৰিম ছিংগাপুৰৰ চিকিৎসা সেৱা কেনেকুৱা আৰু ভাৰতৰ চিকিৎসা সেৱাৰ মাজত কি পাৰ্থক্য কি দেখে আৰু বহু কথা আমি পাতিবলৈ চেষ্টা কৰিম চ' প্ৰফেসৰ লণ্ডন ইজ with us for this special interview, and he is the senior hepatobiliary surgeon of the world's one of the most prestigious hospitals in the world, the Singapore General Hospital. Professor, welcome to India and welcome to Assam. You have been associated with medical sciences in Singapore since last more than 30 to 40 years. You said 40 years. Okay. So how are the challenges of working as a surgeon in such an advanced country like Singapore?
Okay. So thank you for the question. I've been a surgeon since 30, 40 years ago. And part of the problem about surgery is that you must always keep up to date and keep advancing. And one of the reasons to be here in Guwahati is to share knowledge as well and to learn from you also. In any country, in any hospital that you're going to, surgery is always evolving. In my lifetime of 40 years of practice, I've seen things change from very basic surgery using hands to now instrumentation, going to robotic surgery and so on. So many things have evolved over time, and it's important to be keeping abreast of it. So most of us will be reading articles quite widely, going to meetings to meet other surgeons to learn from them as well, attending conferences and sharing knowledge and so on. So those things are important as you want to progress, and the doctors here in Guwahati are also trying to learn by organizing CMEs like this. I hope that answers your question.
What are the differences that you used to see between the medical sciences of Singapore and India? Because you also used to visit India frequently.
Thank you. I've been to India several times to share information and speak at conferences. India is a very advanced country medically as well, and there are many Indian surgeons who are on the forefront of things like laparoscopic minimally invasive surgery, as well as in transplantation. So Indian surgeons do stand on the forefront in many areas as well. So I wouldn't say that we are more advanced than India is. I think we are both advancing and progressing in the same way and learning from each other as well. So I'm quite happy to be in India to share and to learn from you as well.
In terms of neurosurgery or cancer surgery, India is also advancing in a very fast rate, and Singapore is one of the pioneers when it comes to medical tourism. So what do you think that the Indian surgeons or the Indian chapter of doctors or the medical associations or the private hospitals, they will have to do so that they can ensure that India too develops in the way Singapore has developed in terms of world medical tourism?
So I think one aspect of tourism for medical treatment depends on the people coming to you. Okay, so for us in Singapore, we don't just operate on our own as surgeons. We work as a team. So in terms of cancer surgery, I'm a surgical oncologist, so I do cancer surgery for liver cancer primarily. And we work together with our medical oncologists, with our research oncologists and so on. So you must have a team of people who can deliver care at the first world standard. Now, for us in Singapore, the countries around us are not as developed in terms of healthcare, and we therefore become a very attractive catchment for these patients to come and seek care from our side. Now, if you want to be in the forefront of cancer treatment for medical tourism, you must be at the leading edge. You must be always number one or number two at the most. And part of it will be being able to show results for your case care. So for us in Singapore, we tend to work in teams. We tend to produce good results. And for that reason, patients do come to us. In India, likewise, you are a big country, you have a lot of people around you who can travel, and medical tourism can also be internal. It doesn't have to be from overseas. It can be between different states, between different cities as well, because different countries may not always want to come to India. It's too far to come sometimes. But in India as a country, you're so big, you don't have to have tourism from external, it can be internal tourism.
So in terms of dealing with the psychological and emotional aspects of a patient who has been dealing with such kind of problems, so how do you used to deal with the psychological and emotional aspects of them?
So you touched on a very important question. I mean, I started cancer surgery many years ago, and part of the reason for choosing this kind of operation is because what you said correctly is that patients who hear the word cancer tend to worry about death, which is very obvious because cancer patients usually die. So about 30 years ago, I went to train in liver surgery and came back to operate on my patients. And the thing that they have come back is that now, instead of not surviving more than 1 year, many of them live normal lifespans anyway. I'll give you one example. The patient they operated on about 31 years ago, this man came in with a baby. The baby was just about few months old, and he had a tumor in the liver that was so big, like a football-sized tumor. And he was told it's not operable, you have 6 months to live. So patients facing these kind of situations are very worried because the baby is so young, he won't see the father grow up. He won't be able to see growing up the father. We operated on him, even though it was a big tumor in the liver. He's still alive, and the son is now working. This is 30 years later. He's now a working adult, and the father is still alive. So these things give hope to patients. So cancer is not a death sentence anymore. If you're operable and the tumor can be removed, there's a chance to survive. So on the emotional side, it's good to reassure patients, to treat them well, and to get them long-term survival as well.
If you brief some of the most challenging cases that you have encountered in your 4-decade-long career.
Yeah, so some of the more difficult cases are those patients who have tumors that are very, very large, or many of them, many tumors in the liver. The liver, although it can regenerate, there are limitations to what we can or cannot do. But nowadays, there are many techniques that we can do to make the liver grow over time and reoperate. So things like stage operation, doing operations in time frame intervals. So operate part of it first, come back later to operate on the second part. Makes us possible to treat those patients as well. Those are challenging cases. When I first started operating, tumors that were small were considered the limit to operate. Tumors that were big were not operable. Nowadays, it's very common to operate on big tumors. It's not a problem anymore. Tumors that were many, more than 3, were considered inoperable. Now we don't. We operate on any tumors, numbers doesn't matter. So things are changing and evolving over time. They're still challenging. We can't change some things that the patients who are older, who are not so fit, they will always be more sick for surgery. And those are challenging cases also. But we take each one and we go through with them and prepare them for surgery.
Since GNRC Hospitals, one of the most pioneer hospitals of Assam, has invited you, what suggestions would you love to tell the people of Assam or the doctors watching NKTV right now on the various sectors on which the advancements of hepatobiliary surgery, the sector of hepatobiliary surgery sector can be advanced in Assam?
Thank you. So Assam as a state and GNRC hospital is actually quite advanced. I mean, see you operating for general surgery cases, and that's quite advanced. But liver surgery has changed a lot over time. And later at my session, I will be sharing about some advances in liver surgery that the doctors here can also learn from. It is not just operating technique, but also systems change. And systems change will be looking at how you form teams around liver surgery, how you enable your team members, including anesthetists, nurses, ICU care, to better care for your patients. And that is something that you could think about in the long term. At the moment in GNRC, most surgeons are general surgeons. That's how I started as a general surgeon. But if you want to be doing liver surgery, you need to go deeper into and focus only on the area. It can be difficult, but over time the volume will build up. Okay? But if you're specialized in a particular area, your results are better. So I think as you move on in terms of progression, as surgeons become more and more sub-specialized and super-specialized, the results will obviously become better.
Over the course of your long career, you have encountered many tragic cases. Also, you have encountered many success stories, some emotional success stories. Would you please love to share or brief us about that? 1 or 2?
So as I mentioned earlier about the patient that I had who had the baby that came in, that's a success story for me because, comparing someone who lived 6 months, won't see the child grow up, to now being able to see the child start working, getting a family going, and that's a success story. But of course there are failures, and no matter what we do as surgeons, we are not God, and some things don't always go the way we want to go, even though we do our best. So some patients, even though you operate and treat them well, tumors do come back, and the tumor biology, the way the tumors behave, sometimes you cannot treat, okay, and that's beyond surgery. But those are our sad cases that we sometimes can't do beyond what man can do.
How do you see or how do you love to approach about collaborating? They usually used to collaborate, and radiologist or gastroenterologist or the oncologist. How can they work together?
So I think the first thing to understand is that the term collaboration is important. Collaboration means there's no single person in charge. Everybody is the same. Okay? And you mentioned a few names. Gastroenterologists are important because they handle the patient's liver function and they see the patients in the beginning. Aesthetics are of course important. Radiologists are important because of interventional radiology component. Radiation therapists, medical oncologists for chemotherapy, the surgeons and anesthetists are all important parts of the team members, including nursing as well. So we got hepatobiliary nurses who guide the patients through the surgical journey. Now, we tend to meet regularly. We meet at least twice a week on combined tumor boards where we discuss complex cases, we talk about the best treatment plan, and we look at results coming thereafter. We do combined research, we do joint clinics, we run sessions together in the same clinic space. Gastroenterologists and surgeons will be sitting side by side to see patients to better produce outcomes.
What motivated you to specialize in hepatobiliary surgery?
So originally I was interested in head and neck surgery, cancers of the jaw and so on, which I did for some years. But then I realized that there were many patients with liver cancers that were not being treated and not being operated on because there was a specialty lack. So I went to train overseas for 2 years and came back and started this service to look after liver cancer patients. And I'm grateful that I've started that because now I have a team of about 12 surgeons who are doing hepatobiliary in my unit. And it's become quite prominent for us as a basic surgical care nowadays compared to what it was in those days where it wasn't even possible to do.
What are the major common misconceptions patients have regarding hepatobiliary surgery or hepatobiliary treatment?
So I think that the most worrying thing for us, Singapore is a very multiracial country, but primarily Asians. And in the Chinese context, liver is the heart of the person. So anything that involves the liver, if it's going wrong, it means death, traditionally to most Asians. So liver tumors were seen as a death sentence to many patients for a very, very long time. But surgery, as you know nowadays, has become routine. Patients go through it like any other operation and they go home well. So these are challenges that we have to break, which is cultural challenges of understanding whether liver is operable or not in the first place. In fact, it was the last area to be operated on for general surgery, as the last domain for being able to subspecialize in a particular area. Of course, we do other kinds of surgery for hepatobiliary. We do bile duct injuries and so on. We do pancreatic surgery as well. But our main problem is still liver cancer as the main focus.
Liver cancer cases have been on a rise in India since the last more than 2 decades. And if you see, in the last decade, cases are world grossing. Yes. So, can you suggest some of the diet measures so that the patient can maintain a very healthy liver?
Yeah, thank you.
What are the things a patient should avoid or a normal person should avoid?
Okay. So I was talking to some of the gastroenterologists yesterday at 6 Mile and the DISPA GNRC as well. And they were telling me that the commonest problem here in Assam, in Guwahati, is actually liver cirrhosis or liver hardening, liver damage from alcohol. And alcohol happens to be something that we can control. As a person, as a patient, if you cut down your alcohol, you can reduce the cirrhosis damage. If you reduce liver damage, the chance of liver cancer is also reduced. So as a advice to you for lifestyle, if you're listening, if you can reduce your alcohol intake, your liver damage goes down, your liver cancer risk goes down. That is the key message to you. If you can avoid poisons to your body, please avoid it and then you'll be fine.
Thank you so much, Mr. Londone, for sharing your very valuable time with us, and we are enlightened to learn so much from you and hope you keep on rocking in the field of hepatobiliary surgery. Thank you so much. Thank you. এয়া আছিলে বিশ্বৰ অন্যতম এগৰাকী শ্ৰেষ্ঠ শল্য চিকিৎসক ডক্টৰ লণ্ডন উই, প্ৰফেচাৰ লণ্ডন উই ফ্ৰম ছিংগাপুৰ জেনেৰেল হস্পিটেল, আৰু তেখেতে বিশেষ বহু কথা আমাৰ অভিজ্ঞতা আমাৰ সৈতে তেখেতে শ্বেয়াৰ কৰিলে। তেখেতে মনৰ কথাখিনি ব্যক্ত কৰিলে, ছিংগাপুৰৰ চিকিৎসা সেৱাৰ বিষয়ে ক'লে, ভাৰতৰ চিকিৎসা সেৱা কিদৰে উন্নতি কৰিব পাৰি জেনেৰেল চাৰ্জাৰীৰ ক্ষেত্ৰত, এই সকলো কথা আমাৰ আগত তেখেতে এনেদৰে মতামতসমূহ তেখেতে প্ৰকাশ কৰিলে।